Many men take Tamsulosin every day, thinking it's a simple solution for prostate problems. But what most people don't realize is how it can affect the body in unexpected ways. Some experience dizziness that makes standing up tricky, while others feel their heart racing for no reason. And then there are sexual side effects that can be confusing and worrying. In this video, we're going to break it all down, clearly and simply, so you know exactly what to expect. Tamsulosin, also known by its brand name Flomax, is a medicine many men take without thinking twice. Its main purpose is to help with prostate problems, especially when the prostate gets bigger and blocks urine flow. The drug works by relaxing the muscles in the prostate and bladder, making it easier to urinate and reducing the frustration of straining to go. On the surface, it sounds simple and harmless, just a pill that fixes a common issue. But here's the thing. Tamsulosin doesn't only act on the prostate. Its effects ripple through your body in ways most people never hear about. What seems like a routine medicine can quietly influence blood vessels, nerves, and other systems. That's why understanding Tamsulosin isn't just helpful, it's essential. If you've ever taken it or know someone who does, it's important to realize it's not just a urinary aid. It's a drug that has far-reaching impacts, and being aware of them can prevent surprises down the line. Tamsulosin works by targeting something called alpha-1 receptors in your body. These receptors are like tiny locks that the medicine fits into, helping relax the muscles in the prostate. But here's the catch. Alpha-1 receptors aren't only in the prostate. They are also found in your blood vessels and certain nerves that control blood pressure and heart function. Because the medicine touches multiple systems, side effects can appear in unexpected places. Suddenly, a drug meant to help your bladder might make your head spin or your heart race. It's easy to overlook because these effects are not obvious at first. The way Tamsulosin spreads its influence through your body is what makes some people feel lightheaded, notice changes in heartbeat, or experience other frustrating symptoms. Understanding why these side effects happen is the first step to recognizing them early and handling them safely. The drug is helpful, but it comes with a hidden ripple effect that most people aren't warned about. Side effect number 1: dizziness and lightheadedness. Dizziness is one of the most common and alarming side effects of Tamsulosin. Many people notice it when they stand up too quickly, feeling the room spin or a sudden weakness in their legs. This happens because Tamsulosin can lower your blood pressure, sometimes sharply, in what doctors call postural hypotension. The body is trying to adjust, but the sudden drop leaves you feeling unsteady, and in severe cases, you could even faint. This risk is particularly high in the first few weeks after starting the medicine, when your body is adjusting to the new effects. Older adults are even more sensitive, often feeling dizzy with simple movements like getting out of bed or bending down. For some, it can be frightening, especially if it happens unexpectedly. Knowing that dizziness is a known side effect can reduce panic and help you take precautions, like standing slowly or sitting down if you feel lightheaded. While it might seem minor, this side effect is one of the most common reasons people end up in the ER, so awareness is key. Side effect number 2: fast heartbeat, palpitations. Some men notice their heart racing after taking Tamsulosin, and it can be alarming. What's happening is connected to the same drop in blood pressure that causes dizziness. When blood pressure falls, your heart naturally starts to beat faster to keep blood flowing to vital organs. You might feel a pounding chest, a fluttering sensation, or a spike of anxiety that comes out of nowhere. For most people, it's mild and temporary, but it can still be unsettling. Some even mistake it for a heart problem, when it's really the body's response to the medicine. The fast heartbeat can make it hard to relax, and in rare cases, it may feel strong enough to interrupt sleep or daily activities. Knowing that Tamsulosin can affect your heart rhythm helps you recognize when it's a normal reaction and when it's time to speak with a doctor. While not usually dangerous, it's one of those side effects that can catch you off guard, especially if you weren't warned about it. Side effect number 3: sexual problems, most confusing one. One of the most surprising and often distressing side effects of Tamsulosin is how it can affect ejaculation. Many men take the medicine without realizing that it might change the way they ejaculate. Semen may come out reduced, or, in some cases, not at all, a phenomenon called retrograde ejaculation. This happens because Tamsulosin relaxes muscles in the bladder and prostate, which are needed to push semen outward. The confusing part is that libido and erections usually remain normal, so sexual desire and performance aren't impacted. But ejaculation feels very different. For many, this is alarming and can lead to anxiety about sexual health. The good news is that this side effect is not dangerous and does not harm fertility long term. But it can be upsetting if you weren't expecting it. Being informed ahead of time helps reduce fear, and knowing that it's a harmless effect can make it less stressful when it happens. Besides the major effects, Tamsulosin can also cause minor but annoying side effects. Headaches, fatigue, and a general sense of weakness are reported by many users. Some experience a stuffy or runny nose, which can interfere with daily comfort. Sleep disturbances can also occur in certain people, making it harder to get a restful night. While these side effects are usually mild and often temporary, they can accumulate, affecting quality of life. Awareness is key because even small changes can feel overwhelming when they continue for days or weeks. Knowing what to expect makes it easier to identify which symptoms are normal and which need medical attention. Not everyone experiences severe side effects, but certain groups are more vulnerable. Elderly patients are more likely to feel dizziness or faint because their blood pressure is more sensitive. People who are already taking blood pressure medications may notice stronger reactions. Starting on a higher dose increases the risk of sudden drops in blood pressure. Simple actions like standing up quickly or being dehydrated can also make symptoms worse. Understanding these risk factors allows users to take precautions, like rising slowly from a chair, staying hydrated, and communicating with their doctor before changing doses. Being aware of who is most at risk can prevent uncomfortable or dangerous situations. While most side effects are manageable, some symptoms require immediate attention. Severe dizziness or fainting, persistent rapid heartbeat, chest pain, or extreme weakness are warning signs that should not be ignored. Even side effects that interfere with daily life, making it hard to work, drive, or sleep, need a doctor's input. Recognizing when a reaction is more than a normal adjustment is crucial for safety. Never dismiss unusual symptoms as just the medicine, especially if they are intense or prolonged. Quick action can prevent complications and ensure Tamsulosin remains safe to use. Never stop Tamsulosin suddenly, and never adjust your dose on your own. Doing so can create unexpected risks, including a sudden return of urinary symptoms or blood pressure issues. Always talk to your doctor before making any changes, even if side effects seem minor. Following instructions carefully ensures the medicine works effectively while minimizing discomfort or danger. Knowledge and communication with your healthcare provider are the keys to safe use. Tamsulosin is a powerful tool for helping urine flow, but it comes with side effects that can affect blood pressure, heart rate, and sexual function. Being aware of dizziness, fast heartbeat, and ejaculation changes allows users to respond calmly rather than panic. Knowledge reduces fear, empowers safe use, and helps patients get the benefits without unnecessary worry. Understanding the full picture turns a simple pill into a manageable, safe part of life.